Hello and welcome to Gundry Health. Today we'll illustrate how to complete our blood spot test. This video will explain how to collect your blood spot and how to properly dry the sample. Dry blood spots are blood samples placed directly onto an absorbent filter paper. The blood is collected from a non-invasive finger prick and left to dry. Before collecting the blood sample, please read all provided instructions and complete and sign all necessary medical collection forms. Wash your hands with warm soapy water. This will help to stimulate blood flow and make the sample easier to collect. Dry your hands thoroughly with a clean towel. Choose a finger from which you would like to collect the blood sample. You should use a finger from your non-dominant hand. It is easiest to collect the sample from your ring or middle finger. Remove any jewelry or rings on the finger you have chosen, as it can restrict blood flow. Use the alcohol wipe provided to clean the selected finger and allow the alcohol to dry completely before taking the sample. It is best to collect the sample while sitting down. Open the packet of sterile wipes provided and place it nearby. Take one of the lancets provided. Make sure that the sterile cap is on the lancet. This ensures the lancet is sterile for you to use. Do not use the lancet if the sterile cap has come off or is damaged. Twist and remove the sterile cap to open. The lancet is now ready to use. Place both blood spot cards next to each other and within easy reach. Open the upper flap of both cards to reveal the 5 dotted lines on each card. Do not touch the dotted circles on the collection cards. To collect the blood sample, position the lancet against your finger. You should place the lancet on the top side of your fingertip, not in the middle of the finger pad. Press the lancet firmly against your finger until you hear the device click. If you do not press hard enough or would like another attempt, you can repeat this step with a new lancet. Remove the lancet from your finger. A small spot of blood will appear on the puncture site. Using the moist wipe provided, blot away the first drop of blood and point your hand downward and gently massage the punctured finger at the base of your finger. A new drop of blood will form. Allow the blood drop to drop onto the first circle of the first collection card. The blood spot should fill the circle. Once filled, move to the next circle with the next drop of blood. Do not touch your finger to the card or rub your finger on the paper, because doing so can contaminate the sample. Each drop of blood should go into its own circle. Do not put multiple drops of blood, or do not top off the same circle with multiple blood drops. If a single drop does not fill the circle, that is okay. Put the next drop onto the next circle. Do not worry if you miss the circle or if the blood drop falls outside of the dotted line. Just make sure that the blood spots do not overlap. Fill all the circles on both blood spot cards. Then clean your finger using the gauze pad provided. Cover the punctured area with the Band-Aid provided. Properly dispose the used lancet into the trash. Leave the blood spot cards open to dry by propping up the cards using the upper flap. The cards will need to dry in the open air for at least 2 hours, but not more than 12 hours. Let the blood spot cards dry naturally. Make sure the blood spot cards are not placed near an open window or somewhere it could be damaged or knocked over. Do not expose the cards to direct sunlight or place the card near a radiator or heating element, and do not put them inside of a cabinet. When the blood spot cards are dry, they will turn a uniform brown color with no red areas. When the blood spot cards are completely dry, close the cover as shown on the card. Place both blood spot cards and the protection pack inside the plastic bag provided and make sure the package is well sealed. Put the bag along with the completed clinical forms inside the self-addressed, prepaid returned envelope and return the package to the lab for processing. If you have any difficulty completing the blood spot test, please contact us so we can provide additional guidance. Thank you for learning more about how to use our blood spot test.